So I think just sort of trying to put the risk in perspective, if currently we have, say, 2 or 3 in 1,000 of our population with infection, in the proposed time frame coming forward in the next couple of weeks, that's likely to halve. So I think just there's a lot of anxiety, I think, around this, but people need to think through in an average, I don't know, infant school with 100 children, the likelihood of anybody having this disease is very small and diminishing with time. So I think we just need to keep that in perspective. The other thing is, picking up Nikki's point, on a public health perspective, there are all sorts of risks, and children who have been invited back to school are at key points of their education, and their longer-term health risks of not getting good basic education, which then takes them into work, employment in adult life, and gives them a prevention opportunity from long-term conditions, is really very important. But I think the concerns that you're particularly referring to are around teachers and children in enclosed environments, if you like. And there is very good advice has come out from Public Health England, lots of input from paediatricians as well, in a hierarchy of controls to manage that risk. It's not simply about a bit of kit, it's actually about how you manage groups. So in many ways, managing them more as if you were a family, where you wouldn't think about putting on PPE or handling in different ways, but you keep in those groups, you can distance within a school. And in fact, school environments, for the reasons which Nikki has said, which are teachers are brilliant. I know as a parent, they were often much more productive than I was at trying to get my children to wash their hands consistently and practice good hygiene. So there's some really strong guidance out there to try and support this. And the background risk of disease is diminishing all the time.